New Day Northwest is sponsored by Primera Blue Cross.
Welcome back, everybody. Time is growing short for people figuring out what type of health insurance coverage to buy. The enrollment deadline is December 15th. That is this Saturday. Here to help with last-minute questions are Justin Cusper from Primera Blue Cross and from Washington Health Benefit Exchange, Nellie Kinsella. It's good to have you both here. Let's start first with who it is we're talking about. If you have employer-based insurance, for example, this is not applicable to you, correct?
Correct, yeah.
Who are we talking about population-wise?
These are folks that are buying insurance directly for themselves and their families.
Okay, so heads up, because we have until Saturday. Why is this year's deadline earlier than it's been in the past?
So,
and he looks at you.
Great question. So for the last few years, we've always had an announcement December 15th from healthcare.gov.
Right.
And that's always been our official deadline. Last year we had about 95% sign up by that December 15th deadline, and we're going for it. We're going for 100% by December 15th this year.
But there was a grace period in the past that doesn't exist now, is that correct?
That's right.
So we do have a hard deadline.
We've had extensions in previous years. This year it's a hard deadline, December 15th.
Okay, so as long as everybody knows, we can get prepared for that. So what are some of the challenges that people face when they're trying to get this done?
So health insurance is complicated.
It is, isn't it?
We know that customers are comparing plans to make sure, you know, is my doctor covered? Are my prescriptions covered? What kind of medical needs am I going to have in the next coming year? So we have lots of in-person help available all across Washington State, almost 300 navigators and brokers who can help on demand. Customers can find this information through the website, wahealthplanfinder.org. You can download our mobile app, WaPlan Finder, and you can find in-person help near you. Those customer support assisters are going to be able to help you find the plan that meets your needs and budget, and also if you qualify for financial help.
Great.
Yeah.
So we'll post all of that information online. And when you say person-to-person help, this is somebody I can actually talk to face-to-face?
You can give them a call. You could walk into any of our storefront locations. We have 10 all around Washington State.
I think that's really important because it's hard sometimes when you're just looking online if you're not used to it. Even with the comparative tools that are sometimes available, it's tough if you don't have somebody that you can talk to. So what kind of help do you think is best coming from you guys? You've got your website, you've got an app, you've got these other ways to reach people. Tell me a bit about how we access that.
Yeah, so most resources you can start online. There's also our customer support center, which actually is offering extended hours till 10 p.m. tonight, so you can give them a call.
In case you don't, for whatever reason, may not have internet connection or a computer, then you can call.
Yeah, lots of language support as well, over 175 translators available through that phone number.
Good.
And then that customer support center is offering even more extended hours up to 11:59 on Friday as well as on Saturday on the deadline. So 11:59 you can give them a call right up to the deadline.
Although we obviously prefer people get started now and not start at 11:58 because that's going to be trouble. Justin, you work with Primera. Can an enrollment center or just an insurance broker help lead you through this?
Absolutely, yeah. That's what I was going to jump in and say is we do have many brokers, and these are licensed agents, and they've been in the industry for a long time, and they work with all of the different health plans, so they understand the in and outs of the market and are great resources for folks. And the health plan, we've got Primera flags out on the street, so you'll know that that is an enrollment center, and stop in, give them a call. They're also working extended hours, so that's a great resource for people.
Perfect. So what are the things that we might need to think about? Let's say I haven't started till now. I realize Saturday's the deadline. What do I need to get together on my end so that a broker or an advisor can help me?
Definitely want to make sure that you have your list of doctors when you're going out there,
because I want to keep my doctor.
Absolutely.
So let's make sure he or she is in the plan.
Right. Yep. And then your prescription drugs as well. So we do have great resources on our website. So you want to go directly to the health plan. Primera.com would be a great place, and we do have those tools that you were talking about earlier. The prescription drug and the Find a Doctor tool to look up.
Right.
But again, the brokers are going to be a great resource to really give you detailed information and help you navigate to the best plan for you.
Now, are these individual plans only, or does it include family coverage as well?
It includes family coverage as well.
So if I'm thinking of, not me personally having a baby next year, that would be a miracle, but if somebody was, they need to kind of think about that as they're choosing a plan as well.
Absolutely. Yep.
Okay.
You want to make sure that you know all your life choices coming up there.
Okay. So what do you think are the most important things that people are concerned about? Is it keeping their providers?
Yeah, we hear that doctor is absolutely number one. We have a tool on Washington Health Plan Finder called Smart Plan Finder. And Smart Plan Finder allows you to input up to 5 doctors, including hospitals, facilities that you might want to make sure are in network for the plan. Prescriptions as well. So you can enter in up to 5 prescriptions and see if those are covered and kind of at what level they're covered. So that really helps customers to kind of see the comparison and then kind of walk out with the plan that meets their needs and their budget.
And then how do you find out about whether or not you qualify for some subsidy or not?
Yeah, great question. Very easily through Washington Health Plan Finder. If you're just wanting to just double check, you can click from the homepage, Browse Plans, and with just a little bit of income information and letting us know how many people you want to cover, we'll give you an estimate for that premium tax credit that you might be eligible for. Last year, customers who did qualify got on average around $260 discount towards their monthly premium. So customers can choose to take that on that monthly basis or at the end of the year when they file their taxes.
Whichever way they prefer.
Exactly.
So that's good. You do have that choice and you can make it. Now, if somebody does miss the enrollment, please don't miss the enrollment deadline, everybody, it's Saturday.
4
but
days.
if they actually did, is there any recourse?
So what happens after open enrollment is special enrollment periods, and those are available for anybody who has a life qualifying event, which, you know, some of the ones that happen most frequently are, you know, I'm pregnant, I'm going to have a baby. I've gotten laid off from my job. I no longer have coverage.
Right.
So those sorts
you couldn't
of
have
events.
anticipated that you weren't going to have health coverage.
And it's the same process. You come to wahealthplanfinder.org, you report that event, and then you can go through the process to get coverage.
Terrific. Yep. Thank you both very much. Appreciate those answers. Again, the deadline for open enrollment is this Saturday, December 15th. For more information and the help offered to meet the deadline, please visit Premera.com, and you can find resources on New Day's website, including phone numbers and locations of support centers where you can get in-person help. After the show, Justin and Nellie are going to join me for a live chat over on New Day's Facebook page, where they will address more of your questions and concerns. Please stay tuned for that as well. That'll happen at noon. Up next, Nellie joins the wellness panel to answer your questions, and we'll be right back.